The Ministry of Health places TB, a bacterial disease, as the fourth leading cause of death in Kenya, with approximately 15,000 deaths reported annually. According to the World Health Organization, TB is a leading killer of HIV-positive people. In 2015, 1 in 3 HIV deaths was due to TB. Despite the worrying statistics, public awareness remains low, impending efforts to contain its spread. TB can attack any part of the body except the hair and nails. It is spread by one person to another through the air when an infected person coughs, laughs, or sings. And as Kenyans join the rest of the world in marking the World TB Day, whose theme is Mulika TB, Malize TB, Dr. Enos Masini, the head of the National Tuberculosis, Leprosy and Lung Disease Program, says Kenya is likely to dig deeper into her pockets to tackle the new strain of tuberculosis.
In this country, we're also facing another burden of drug-resistant tuberculosis. This is tuberculosis that is resistant to the drugs that we commonly use for treatment. Now, the burden of drug-resistant tuberculosis comes from the fact that it takes much longer to treat. While the ordinary tuberculosis takes 6 months, this one takes 20 months to treat. The drugs are much more expensive. It will cost about 1.5 to 2 million for direct costs of treatment alone, without the cost for diagnosis, without adding the cost that the patient and the family will incur in time spent away from productive.
Meet Rose Karimi, a mother of 3 from Embu County, who has been battling TB for close to 2 years now. An ailment she thought was only associated with the urban poor living in the slums. A costly assumption that made her seek medical assistance way too late. She was once a subsistence farmer, but this occupation has suffered due to her incapacity to supervise operations. And her woes don't end there. She has suffered stigma, with friends constantly referring her to a person living with HIV.
Sairo wanaona siendi kutembei vizuri, wanaanza kunipandilisha wakisema ni ukimwi. Sasa nikawaambia ukiwa ni ukimwi tutafanya ingi watakao wakiwa wananiona, lakini ikiwa si ukimwi.
The disease has also robbed her of her perfect posture. Karimi's walking style now resembles that of an old granny. According to Dr. Masini, counties that border Somalia to the east, namely Wajir, Mandera, Isiolo, and Garissa, including Dadaab refugee camp, has the largest number of patients suffering from the new strain of tuberculosis.
For us in drug-resistant tuberculosis, the key thing is about prevention, and prevention of it is ensuring that if you have been prescribed or given drugs for tuberculosis, for the ordinary tuberculosis, you must take your drugs as prescribed by the doctor or your healthcare provider. For if you don't, the TB germs are likely to develop into drug resistance.
It affects people of all age groups. Symptoms include persistent cough with spectrum and blood, sometimes accompanied by night sweats, weight loss and fever. Despite TB treatment being free, Karimi had to purchase medication after she was diagnosed with a new TB strain at Embu General Hospital. Her status has affected mobility. She can no longer attend clinic, an inconsistency that has further compounded her quest to treat TB. And with the ministry estimating that 20,000 TB cases remain undetected, untreated, Karimi will remain using her bare hands to cover her cough while she awaits treatment at Mbagathi Hospital in Nairobi, where she was referred for specialized treatment. Linus Moshigadi for Channel 1 News.